This installment of the Crucible evaluates the methods that we're using to prevent medication-related malpractice lawsuits. And the paper was published online in 2012, and it's titled Medication-Related Errors and Liability. The authors examined 3,310 consecutive lawsuits from a large malpractice insurance company. They found that medications were the subject of 6 to 12% of lawsuits. The most commonly involved medications were anticoagulants at 24%, and almost all of that was Coumadin, opioids 18%, corticosteroids 10%, and aminoglycosides 9%. Allergic reactions accounted for only 4% of medication-related lawsuits. Now, if you read any article on the topic of reducing medication-related lawsuits, the biggest area of concern is allergies. And this is interesting because we already have allergy armbands, allergy stickers, and allergy alerts on every page of the medical record. But despite all that, allergies continue to receive the largest amount of risk management attention. The problem is that allergies are involved in only 4% of medication-related lawsuits. And it wasn't published in this paper, but most of those people were not previously known to be allergic to the offending medication. So perhaps 1% of all medication-related lawsuits are caused by someone getting a drug to which they were known to be allergic. And while that's tragic, the number is so small that even if we did the impossible and completely eliminated it, the impact on the overall number of lawsuits would be negligible. So the first thing we can conclude is that we have to look somewhere else if we want to reduce the number of lawsuits. The other area that gets a lot of risk management attention relates to penmanship and communication. And the issue here is that we write a 4 and someone thinks it's a 9. Or we put a decimal point in the wrong place, or we say digoxin and someone thinks we said dilantin. And people call these systems errors, which I don't understand because the system didn't write a 4 that looked like a 9, some doctor did. But whatever you call them, they receive a lot of attention. Unfortunately, they're not causing many lawsuits either. Now, how do I know that? Well, if lawsuits are caused by handwriting and communication errors, then the errors should be randomly distributed among all the drugs that are used. And the most commonly used drugs would be at the top of the list because they would be hit the most often by the random errors. And the list would be comprised of antihypertensives, statins, nonsteroidals, beta-lactams, and diabetes meds, but none of them are on the list. You see, if the problem is misplaced decimal points that lead to tenfold dosing errors, why isn't insulin on the list instead of corticosteroids? A tenfold dosing error of prednisone doesn't do much of anything, yet it's on the list and not insulin, where a tenfold dosing error is devastating. If the problem is look-alike, sound-alike medications, which everyone says it is, then why is Coumadin at the top of the list? What does Coumadin sound like? You see, what people are missing here is that there's a difference between the types of errors that occur at the nursing station in the administration of a medication and the types of errors that lead to malpractice lawsuits against physicians. At the nursing station, it's decimal points and look-alike, sound-alike. But those things have almost nothing to do with lawsuits against physicians. So if we want to prevent lawsuits, the first thing we have to do is look beyond the nursing station and recognize that it's not a systems problem, it's a localized problem that's caused by a few meds. Coumadin is 24% of medication-related lawsuits. The allegation is almost always failure to properly monitor. And the problem is that monitoring Coumadin is very labor-intensive, meaning that there's a good chance we'll eventually miss something, and that'll put us on the hook. Now, how do we prevent that? Well, most experts would say that we need better systems, better communication, and better documentation, which is the same thing they always say, and it's not very helpful. The way I see it, we have 3 options. First, we can send the patient to a Coumadin clinic where the drug will be managed in a manner that can withstand legal scrutiny. Second, we can use one of the newer anticoagulants like apixaban or dabigatran because they don't require much monitoring. You see, if you're going to sue me for failure to monitor, then I'll either have the monitoring done in a meticulous manner at a Coumadin clinic or I'll use a drug that doesn't require monitoring. Either way, I've eliminated a potential lawsuit. And finally, option 3, and I'm assuming that whatever you do here is in the best interest of the patient, but option 3 is to do something that eliminates the need for the anticoagulation. Now, this is just my opinion, but I think these 3 options can eliminate 2/3 of the anticoagulant lawsuits. And if you do the math, that would eliminate 16% of medication-related lawsuits and 2% of all lawsuits. That would be a staggering accomplishment, and it's right here for the taking. Thanks for listening.